Hi there, we're ready for another edition of This is the Bronx at Noon. I'm Gary Axelbank, and with me is Dr. Lewin, and Dr. Lewin is part of this very, very interesting new project called the Diabetes Relief Centers, and they're finding a home here in the borough of the Bronx. So the first thing...
Please call me Jack.
All right, Jack.
Thank you.
Because in the Bronx we're very informal.
Yeah.
But this really is a very important thing because we know that if you are going to try and treat the epicenter of diabetes, it comes at the Bronx.
Yeah.
Tell me about what you are attempting to do here in the borough of the Bronx.
Well, look, the thing is, all of us doctors in Western medicine, we've done a lot to try to treat diabetes, and we do have some help, with insulin therapy and with other oral medications and prevention, diet, exercise, and so forth.
And these are all after the fact.
But the fact is, we're not really doing better with diabetes. We still have the complications in the long run. Even when people do things right, they tend to feel guilty, like I'm bringing this disease on myself, and that's not right. And they end up with kidney complications and heart complications and amputations and all that stuff.
And then we're cycling it around and around, and we're never solving it.
We're not really solving the problem. So here's what the guy who founded this, Ford Gilbert. His daughter had diabetes. He was a lawyer. He had a very successful law practice. He quit everything and got a PhD in human physiology, because he wanted to understand diabetes.
So let's get to the point. What is it that was created?
Well, it was the idea is that it's metabolism, carbohydrate metabolism in every cell of your body is abnormal in diabetes. It's not just the level of glucose or the hemoglobin A1C. So he started providing a treatment that every week to 2 weeks, if you take this treatment, it restores normal metabolism in your body. You digest carbohydrates in the way that non-diabetics do. And the effect of that is it reverses neuropathy, it gets rid of which causes amputations ultimately, it reverses the risk of kidney disease, it reverses the risk of heart disease, and it's amazing. And it's really kind of a simple formula. And so it's based on how the pancreas works in your body.
So, and the idea is this is now going to be established in the Bronx. We don't want to start counting whether asthma is a bigger problem or diabetes is a bigger problem. We know that we're 62nd in the state in health, and this is one of our biggest problems.
Yeah.
You're about to do what? Establish this
We're establishing this clinic here in the Bronx, and we really would like to take people who have the riskiest situations with diabetes, or take the higher risk people.
Well, in the Bronx, I wish I didn't have to tell you that, but it is a fact. Are you hopeful that this will have an impact on the treatment of diabetes?
I'm hoping yes, because all of the resources that we have in this community is very much needed.
Have you been educated as to what this treatment actually is and how it works? Do you have a sense of it? And then why do you think this what with diabetes may be more successful than others?
Well, I've done a partial research, and I like the idea that it actually focuses on those patients, individuals in the community that are near having complications, that are near having amputations, that are having vision problems, that their levels are extremely high and they're on much insulin, and that they have a special treatment for those. So that kind of piques my interest.
And I have to tell you, what I really like is the fact that it's going to be located here at the hub on 3rd Avenue, at the 3rd Avenue bid, so it's anybody can stop by, people traveling through or we have this not 62, which is very, very annoying because we don't want to be 62 anymore.
That's right.
Does this give us a chance to maybe finally have us not be 62?
I believe so. I hope so, because every little bit helps.
Very good. Ms. Vasquez, thank you so much. Thank the American Diabetes Association for everything they do. And that's it. That is our edition of This is the Bronx at noon for today. And we'll see you around the borough of the Bronx.